what separates us in terms of how we work with patients with Alzheimer's and dementia is that I have a specialized training in this work, and so I've been practicing as a trained psychotherapist working with older adults generally, but more specifically with patients who are diagnosed with Alzheimer's and dementia. And so what I bring to bear is not only my clinical expertise, but I'm also a former family caregiver. So I cared for my grandmother who had Alzheimer's disease for almost 8 years. So what comes with me is my personal experience, my clinical experience, and helping not only our caregivers, but our care managers to really recognize and understand how to work competently with patients who have cognitive impairment. Alzheimer's and dementia patients are different because they require specialized caregiving. The cognitive impairment alone requires, oftentimes in the middle stages of the disease, requires caregivers that are able to adopt specific strategies on how to manage challenging behaviors, including agitation, combativeness, and other types of behaviors that are pretty common with dementia: wandering, sundowning, refusal to bathe, refusal to take medication. So a lot of resistance to care, and before families try antipsychotic medications, we really have to think about how we can use behavioral strategies. Our caregivers are trained on how to do that. So the memory care team is made up of me, Dr. Hart, and our care managers. And our care managers are really the bridge between the family and the caregiver. So the care managers go out and complete the assessment, identify what needs are present for the client, and then that information gets back to the caregiver. And we specifically train the caregiver to tailor their interventions to that particular client. So it's not a one-size-fits-all here. It's very specialized training. What we wanted to do is we wanted to take some of the behavioral techniques that we use in adult day healthcare, and apply those to the hospital setting to limit the use of physical and pharmacological restraints of dementia patients in the hospital. And so we used 4 tools. We used a teddy bear, folding towels, stress ball, and music. Our approach was to train the nurses on how to use these techniques to redirect aggressive, agitated, combative behavior of their patients. We were able to do that at the hospital. We reduced the use of restraints by 60%. And so we use these exact tools in helping them to understand how to validate their patient, how to join them in what their need is, how to distract them from what they're focusing on, and how to redirect their behavior to something that's more useful for them in that moment. The approach that we use is making sure that family member, caregiver, care manager all have the same information. So we're working from the same foundation, from the same script. So we recognize what the issue is and how to solve it. So whether it's using these behavioral techniques or using validation therapy or distracting and redirecting, we're all focusing on the challenge from the same direction. And that's what solves problems. And that's what provides relief for family members.